Next question, the member for Scarborough-Guildwood.
Speaker, my question is to the Deputy Premier and Minister of Health. Speaker, at the beginning of this month, the Scarborough ICU Director was quoted, "We are beyond capacity and I expect it will only get worse." Scarborough has remained a hotspot for almost a year now, with no break in the spread of the virus in our community. Hospitals are seeing whole families admitted as COVID-19 positive, and sadly, some members of the family don't make it out, while others do. And you've heard that Dr. Davila said yesterday, "I have never been as worried about the future as I am today." Speaker, how can the residents of Scarborough feel safe with the emergency orders ending, its Chief Medical Officer of Health so worried, and we're going headlong into a third wave of this virus with unknown variants?
Question.
Deputy Premier, what are you doing to make sure that the people of Scarborough feel safe?
The Deputy Premier and Minister of Health.
Well, we have, since the beginning of this pandemic, taken every step possible to protect the health and safety of all Ontarians. That being said, we recognize that there are some areas where there have been particular difficulties. We made accommodations for that in allowing for things like testing during weekends, people walk-in testing rather than to have an appointment, mobile testing, working with local hospitals for going into neighbourhoods and helping out, working with community health centres, by also having areas where we have set up 1,500 isolation spots for people in situations where if they have COVID, they can then go and isolate on their own so that they don't infect other family members. These are all steps that we're taking, recognizing that there are some areas that have particular difficulties, and that's what we want to do to keep the variants of concern at a minimum and not overwhelm our hospital capacity. But we certainly recognize there are areas in Toronto particularly, and other areas, Peel as well, where we have to pay particular attention. We are on the testing side, and I can also...
Thank you very much. The supplementary question.
Back to the Deputy Premier. Deputy Premier, we need one of those isolation spots in Scarborough that is family-friendly, because that's one of the problems that we have. It's been 11 straight months of battling COVID-19 for Scarborough's hospitals, doctors, nurses, orderlies, admittance staff, frontline workers in our healthcare system, and they are exhausted. I thank them for their compassion and for their care. And when it comes to this virus, and now with the new variants spreading in our province, there is a sense of dread that they have. They don't know what is coming through the door next. Despite loud warning bells, the stay-at-home orders are coming to an end on Monday. In Toronto, schools have already reopened. The hospital workers in Scarborough know that there's community spread. They know that these changes are going to increase their workload and that more people will die. Speaker, through you to the Deputy Premier, can you tell us specifically about the genomics testing? What variants are we testing, and when will you report on this to the people of Ontario?
Thank you. Minister of Health to respond.
First, let me say we are also very grateful for the work that's being done by all of our frontline healthcare workers. They have been really put to the test over the last year. We're certainly aware that many of them are exhausted, that they are working extra hours, that they are putting themselves in danger as well. And we hope to be able to have the vaccines available to make sure that all of our frontline healthcare workers can be immunized as quickly as possible. But we are aware of the stress in our hospital system capacity. That's why we've put several billion dollars into expanding spots. We've created over 3,300 new beds since this time last year. We know that we need extra spaces. Just recently, we put another $125 million into creating 500 more spots, acute care and medicine beds across the province to make sure that we can handle any surges in capacity.
Response?
But that is partly with the opening of the Cortellucci-Vaughan Hospital and other spaces that are being created. But we are certainly aware of the need for immunization and the screening and testing, which you're also asking about. We are testing every single sample now and screening it to determine.
Thank you very much. Thank you.